Hi and hello everyone. Here we are again on Hello World with me, Miss Effa. So, how are you guys doing today? I hope you guys are doing great. So, every week in this program, we come and talk about interesting topics. So, today we will talk about marijuana, which is entitled Marijuana Legalization, Physicians and Effects on Physicians and Public Health. So, here we will talk about the legalization of marijuana with important implications for public health and physician practice. Before we go further into our discussion, let me introduce you to marijuana. So, let us see the video that I have prepared together. So that is a little bit introduction to marijuana, and I hope you guys can understand the info that I want to provide in the video that I have shown. So in a simple word, marijuana is the dried flowers or leaves of the cannabis plant that also can be called as pod, dope, and cannabis. It includes mind-altering chemicals like tetrahydrocannabinol, or as known as THC, as well as non-psychoactive active molecules like cannabidiol, or as known as CBD. Marijuana is commonly taken via smoking joints or blunts. Vaporizer use has lately grown is an effort to avoid the possibly hazardous consequences of marijuana combustion. Although the smooth of cannabis ingestion may theoretically eliminate toxic inhalation, through clinical trials verifying its safety have yet to be conducted. Although marijuana remains illegal in most of states, specific components of marijuana have been refined, evaluated, and authorized as medicines for certain diseases by FDA or equivalent regulatory authorities. Oral THC is available as dronabinol, or as known as Marinol R, and has been authorized by the FDA for the treatment of HIV or AIDS, cachexia, and chemotherapy-induced nausea or vomiting. Nabilon, or as known as Sesamet R, is an oral THC analog that has been authorized by the FDA for the treatment of chemotherapy related to nausea and vomiting. However, Nabisimos, which is known as Sativex R, is an aromatase spray combination of THC and CBD in a 1:1 ratio that has been authorized by regulatory bodies in Canada and several countries around Europe to treat pain in multiple sclerosis, which is also known as Alzheimer's disease. So, true dronabinol and nabilon are both FDA approved for the treatment of HIV or AIDS cachexia and chemotherapy related to nausea or vomiting. It is unknown if marijuana is also effective for these diseases. Numerous additional chemicals such as cannabinoids, flavonoids, and terpenoids found in smoke or edible marijuana may interact with THC's effects. Large randomized controlled trials have demonstrated that nabiximols are effective for MS-related specificity, and at least 2 RCTs using smoked marijuana or an oral cannabis extract are also effective in this condition. So, at least there are 3 randomized controlled trials, which is RCTs, designed to assess the efficacy of smoked marijuana for at least 5 days in the treatment of neuropathic pain have led to substantial improvements, with further support from ongoing trade. Furthermore, major trials examining the effectiveness of nabiximols or an oral cannabis extract in neuropathic pain have revealed promising results. In general, robust clinical evidence for additional indications is absent. Preclinical research, on the other hand, suggests that cannabis have anti-inflammatory and anti-convulsant important in the treatment of PTSD. Evidence also shows that cannabinoids may temporarily reduce intraocular pressure, indicating that they may be useful in the treatment of vision. More study is needed, however, to determine if this preclinical finding transfer into clinical effectiveness and to investigate the possible hazards of smoke or edible marijuana against oral or nasal cannabis extracts. So now let's go to the proof to support the use of marijuana or cannabinoids for some ailments. So, all right. So this is some proof to support the use of marijuana or cannabinoids for some ailments. For the first one, we have cachexia or anorexia. Second one, agitation in Alzheimer's disease. And the third one is pain. So this is, I put some elaboration there. So I give you some times to read the elaboration before I elaborate more about it. Okay, so, for the first one, I will talk about cachexia or anorexia. Okay, cachexia or anorexia is a type of disease. Okay, so a large of randomized controlled trial, which is contain 243N, comparing oral THC or a cannabis extract and control for the therapy of cancer-related cachexia revealed no difference in treatment groups. The FDA has authorized dronabinol of the treatment of cachexia in HIV or AIDS patients. Then another major randomized controlled trial, which contained 469N, found that oral THC is inferior to megestrol in cancer-related cachexia. So next, for the second one, agitation in Alzheimer's disease. A small RCT which contained 12N found that dronabinol therapy reduced agitation while sedation was a prevalent side effect, indicating a non-specific impact. The long-term safety of psychoactive cannabis is demented individuals is possibly problematic and has not been extensively investigated. And the last one, pain. Although not all studies were favorable, large and moderate-sized RCTs have proven the efficacy of nabisimols or an oral cannabis extract in the treatment of neuropathic pain. Smaller, which is 5-day studies, have shown that smoked marijuana may be effective in alleviating neuropathic pain. So there is also preliminary evidence for rheumatoid arthritis, but less evidence for non-neuropathic pain. So that's all for the proof to support the marijuana. And so I know you guys seems like a little bit busy or a little bit bored. So before we go further to our next discussion, I want to tell you guys about an interesting fact, which is did you guys know that there are some countries that provide and serve marijuana pizza? It sounds weird. It sounds weird, right? But yeah, it's true. And some of the restaurants called the marijuana pizza as happy pizza. I don't know the reason, but I think because it, marijuana, so it can make us become addictive to the pizza. So maybe because of that, they call it happy pizza. So if you want to know more about this fact, you can search for it in the Google or YouTube. There are so many information about it in the internet. Okay. So now let us continue with our discussion. So about the marijuana legalization, however, there are some issues regarding of the legalization of marijuana. Firstly, diversion of legal marijuana to minors or adults who have legal access to medical for recreational marijuana will provide cannabis to the teenagers. So in a cross-sectional study, over half of Colorado teenagers enrolled in outpatient drug addiction treatment reported using misplaced marijuana. Those who had used diverted medicinal marijuana were more likely than those had not to report easy access of marijuana, more than 20 times of use per month in the previous year, and low peer criticism of frequent use. Another research discovered a comparable high percentage, which is 74% of teenagers in drug addiction treatment who had used diverted medicinal marijuana. The legalization of marijuana in Colorado, as well as its de facto federal prohibition, has resulted in the development of youth, which is 9 years of age or younger, instances of accidental consumption of marijuana. So, the next issue is marijuana and opioid use, which is another important issue in the policy debate. There is evidence that marijuana or cannabinoids can be successfully relieve various types of pain or discomfort. It remains to be seen if at least lower the dose of their pain relievers. To the best of our knowledge, no scientific investigation examining the efficacy of cannabis or cannabinoids for chronic pain has demonstrated that cannabis use helps patients to reduce their opioid analgesic dosage. In addition, cannabis usage has typically been linked to an increase in narcotic use. And So for you guys information, there are one latest reviews, however, shows that the introduction of medical marijuana legalization may be related with a reduction in drug overdoses mortality over time when compared to projections of overdose death if these laws had been implemented. Interestingly, states that have medicinal marijuana legalization had higher rates of maturity drugs overdose mortality than those that do not have such laws. More research from epidemiological studies to investigate the relationship between the passage of medical marijuana laws and the acceptability of drug use and clinical trials to investigate whether marijuana use to treat pain can allow patients to lower the opioid analgesic doses while maintaining similar rates of analgesia is required. Despite of these issues, marijuana also bring adverse health effects to the human. Marijuana usage is associated with a number of negative health consequences, including addiction, decreased cognition, pulmonary effects, mental illnesses, and other issues. So for the first one, I will touch about addiction, which is addiction develops in around 1 out of every 10 adult marijuana users, and the figure is even greater among teenagers. So we can say that marijuana's lifetime dependency rate is typically lower than that of other substances such as alcohol, heroin, and cocaine. Marijuana dependency, however, is the most common substance addiction diagnosis, surpassing alcohol and cigarette dependence. The next one is marijuana impairs attention and focus, impulse control, planning, decision making, and working memory among infrequent users 0 until 6 hours after use. Marijuana usage causes shorter response times in basic reaction time, visual spatial selective attention, sustained attention, split attention, and short-term memory tasks, as well as impairment in motor control. Acute abstinence from cannabis causes more cognitive damage than acute usage in chronic ordinary users. So in fact, marijuana has been shown to restore the cognitive impairment associated with cannabis withdrawal. However, this most likely indicates a lower degree of cognitive performance than previous to the beginning of usage. So I think we have discussed many things on this topic, and I think it's time for us to conclude the whole discussion. So let me conclude it for all of you. So in my opinion, in a nutshell, marijuana's legal status is quickly changing with significant consequences for public health and professional practice. The evidence supporting the genuine medical use of marijuana or cannabis is restricted to a few indications, most notably HIV or AIDS, cachexia, chemotherapy, nausea or vomiting, neuropathic pain, and MS spasticity. So substances have shown that clinical potential in various areas, although strong clinical proof is still missing. So the link between legality and prevalence remains uncertain. So states that have been legalized marijuana have greater rates of usage than non-legal states, although these higher rates can be seen even before legalization. As states continue to legalize marijuana for both medical and recreational purposes, a number of public by children, the relationship between marijuana and narcotic use, and whether marijuana use will lead to an increase in health problems such as addiction and pulmonary problems. However, more study is urgently needed in order to understand the impact of legalization on public health in light of the constantly changing legal context. Before I end our program, I think you guys might have some question to ask. So you can type the question on the chat box and I'll give you time. Then I'll answer the question for you. So I think there is no question from the audience. So I think that's all for our program today. So have a nice rest and thank you. Goodbye.